Let's begin our conversation with the country's situation with regards to COVID-19, because Health Minister JoyNews says private businessman from Dubai, Sheikh Dalmook, has terminated his contract agreement with government over the procurement of Russian Sputnik V vaccines to the country. Reason? The Sheikh, in a letter to the Health Ministry, explained that the company was struggling to raise 3.4 million doses of the vaccines. Government came under heavy criticism after it emerged it sidestepped regular channels and resorted to middlemen in the procurement of the vaccine. The health minister subsequently justified the move, arguing government had no choice but to procure the vaccines to save lives of the citizenry. Appearing before Parliament's committee tasked to probe the procurement of the vaccines, Mr. JoyNews observed that in spite of the 20,000 doses of the Sputnik V vaccines supplied to the country, government is yet to pay any money to the company.
For now, the contract will exist, but because of the scarcity, again, SA Global is also giving us indications of the fact that they will not be able to supply. So we are still engaging.
Yeah, Honorable Minister, you've been preaching scarcity. Is there any other provision as far as you are terminating this agreement? Do you have any further proposals that reassures Ghanaians that your office is doing all it can in the midst of scarcity to still secure vaccines for the greater population?
Thank you, Honorable Chair. Let me correct a little impression. We did not actually terminate this contract. The supplier voluntarily has terminated the contract because he's not in the capacity to supply. Now, like I said earlier, we have other arrangements in place. What motivated me, the ministry, to go this direction was the fact that supplies from the big platforms we were going to get were going to be delayed. For now, the contract will exist, but because of the scarcity, again, SA Global is also giving us indications of the fact that we are still engaging.
Yeah, Honorable Minister, you've been preaching scarcity. Any other provision as far as you are terminating this agreement? Do you have any further proposals that reassures Ghanaians that your office is doing all it can in the midst of scarcity to still secure vaccines for the greater population?
Thank you, Honorable Chair. Let me correct a little impression. We did not actually terminate this contract.
It says the second contract with another intermediary firm, SP Global, is also under review. Let's have a conversation on this issue. Dr. Kwame Sapong-Siedu is a pharmacist and a fellow with the Center for Democratic Development, Ghana. I'm grateful for your time, Doc.
Good afternoon, and I'm grateful to be on your program as well.
Doc, this doesn't come to you as a surprise. Why?
Well, you only have to listen to the minister to come to the conclusion that it shouldn't have come to any Ghanaian as a surprise. The minister was unequivocal in saying that the government knew as far back as February that the global supply chain was going to be delayed for 6 months. That's not me speaking, that's the minister speaking. So at that point, they decided to go into a contractual obligation with people who by that time had tried to supply to Pakistan and had gotten into a lot of challenges. So they then went on to breach the contract in April, and they breached in May. How we kept on hoping upon hope that they were going to deliver when we knew that a 6 months timeline, which is what now we have defaulted to, because we are now relying on whatever is coming to Ghana from the US and from gov't to start our vaccination drive again. So for me, I knew we were going to get to this point. And in fact, I had said that we were going to get to this point because there was no way the guys had the ability to supply. If you understand how Glimea and the Russia Development Fund operate and who was going to actually manufacture the Sputnik vaccine, which was an Indian company, which had been shut down because of the COVID escalation in India. So if you put it all together, the doses were not available. So if the doses were not available even to the regular operatives, how did we expect that the sidearm was going to get it for us? And that's why I'm not surprised.
Doc, what does the termination of this contract mean to our vaccination or even building herd immunity?
For me, it means nothing because it was not going to happen in the first place. For some of us, we never used this as part of our calculation. So nothing has changed in the sense that it wasn't going to come anywhere. But the second part of your question is towards herd immunity. Our hope should be that if you understand that these vaccines are under emergency use authorization, the expiry dates are normally 6 months because they are produced over a short period of time, which then means that a lot of the global large countries which bought a lot of vaccines have vaccines that would most likely be expiring in August and September, which they are unlikely to use. So from a geopolitical standpoint, they would want to offload it to COVAX and to other countries just to get political gravitas. For me, that is what's going to open the supply chain up. And when that happens, we're going to get vaccines. We know from G7 that the US promised 500 million doses. The minister has said when he was at the interview in Parliament today that we expect 1.2 million doses from that. It is very, very likely that that is going to land on our shores because the Americans are way, way advanced in their vaccine rollout that they can afford to shed off these doses. The UK is doing the same thing, and I know that soon Germany will start doing the same thing. So August, September looks quite positive, but we need to see also how India comes along because last week, there was an announcement from the Serum Institute of India that they are also going to start producing the Sputnik vaccine. They are the same company that produces the AstraZeneca vaccine. Should that happen, and should Biological E, the original contracted producers of Sputnik, come upstream, then obviously the supply chain is going to get even more fluid and open up more. And at that time, I would have hope. And that is the point some of us were saying the world will get to after 6 months, and others didn't understand. So I think it's looking a lot more positive from the supply chain standpoint, and therefore I wouldn't worry too much about the Sputnik vaccine.
Doc, there's a possibility of a third wave. I'm saying this because just yesterday, the Ghana Health Service has been warning the public as to how dangerous our situation is at this moment. Ideally, what should be our target, or what should we be doing at this moment?
Aisha, truth of the matter is, at this moment, even if we were to get vaccines today, it's not going to factor into our drive towards a third wave. I'd explain that, so I'd want to make it clear. So the only option now is compliance with the protocols, because we are dealing with a variant, the Delta variant, which has a reproductive number of 5 to 8. That is extremely contagious. I mean, it's going towards the league of measles and a lot. So you cannot play with your life or play Russian roulette and not wash your hands, not wear your mask. Even if you're vaccinated, you need to do that. Now, why am I saying vaccines wouldn't help us? If you know the way these vaccines work, even with the one-dose vaccines, after your first, it takes about 22 days for optimum immunity to build. And then 2 weeks after your second dose, your maximum immunity builds. If you look at the rollout plans for Ghana and for most countries, between the first and second dose is 8 weeks or sometimes 12 weeks. So if after the 8th week, you are waiting another 2 weeks for maximum immunity to build for most patients, you are looking at a 10-week time window before you can get the impact of the vaccines on the herd immunity or on slowing down the spread of the virus in the community. So we cannot wait 10 weeks. This one spreads too much. By then, if we played that game, we would have infections all over the place, and that wouldn't be good for us. So we shouldn't calculate using the vaccines at this point in time. We should calculate using the protocols.
What's the situation in the UK as we speak? We're hearing that now kits are also being infected, especially with the Delta variant?
Yes, I mean, that is going on globally. The thing about the UK is, I mean, if you look at January of this year, we were having about 35 to 40,000 new cases every single day, and deaths were about 2,000 a day. Now we are having the same number, and deaths are the 7-day running average of deaths is about 29 a day. That is how the vaccines have cut down the hospitalization and mortality. If you look at the mortality, the hospitalization graphs as well, hospitalization is down by about 84%. So what does that mean? It means that the vaccines are working. Okay. The other thing you see is if you take about the 40,000 people who are getting infected, you realize that about 35,000 haven't been vaccinated. Then there are a significant number of the remainder who have actually had just one dose. But the interesting thing is those who have even had one dose, like the Director General of Ghana Health Service said at the press conference yesterday, and those who have had 2 doses are highly unlikely to go into hospital, even though a few who are above the age of 65, unfortunately, have had 2 doses, have gone into hospital and passed away. But the investigation also points to the fact that a lot of them have immune compromised conditions and their immune systems are not as robust, so they might not have gotten optimal immune protection for the vaccines they received. And that is why I'm saying that in the case of Ghana, if I look at all the data from the UK, in the case of Ghana, we cannot play that Russian roulette, because if we did, then obviously their immune systems are not strong enough, who probably have had 2 doses, who could get infected and could unfortunately pass away. So that is how I've linked the two, the UK and Ghana.
Dr. Sapong Asiedo, extremely grateful for talking to us. He's a pharmacist and a fellow of CDD. The story so far with Sputnik V, and of course, let's look at some of the visuals on our screens so we can talk about the story so far with the Sputnik V, the agreement between the Ministry of Health and Sheikh Dalmook and versus Ministry of Health and the response. So the total price is inclusive of documentation, shipping, packaging, and logistics and expenses. Now, the total quantity of 3.4 million per unit cost is $19 US dollars. The total price is 64.6 million US dollars. The Ministry of Health's response, it says, the $19 US dollars per unit price was a result of land transportation, shipment, insurance, handling, and special storage prices. The total quantity 3.4 million and $19 US dollars for per the unit cost, and that's what the Ministry of Health has been explaining today. The minister himself has been giving answers as to why we are not getting the Sputnik V vaccines as arranged with this middleman. Now, it says the delivery status is not delivered. Total 3,400,000 doses, 15,000 vaccines expected on 3rd March, 185,000 to 300,000 vaccines expected by the end of March, not delivered. 300,000 to 600,000 vaccines expected by April 2021, not delivered. 600,000 to 1 million vaccines expected by May 2021, not delivered. And you can see the sign there showing why it has not been delivered. 1 million to 1,485,000 vaccines expected by June 2021, not delivered also. And as you can tell, we are already in July, and the 3 point, you need this. These are some of the things you need to note about this whole thing. The 3.4 million doses shall be delivered based on the availability and allocation of the supply to the seller and buyer's ability to purchase. So in this case, the buyer says he can no longer procure the vaccines for Ghana, and that has led to the termination of the contract. The seller will make best efforts to expedite the supply order schedule. And this is from the Ministry of Health's response and the vaccine purchasing agreement That's where we're getting this information. The Sputnik V vaccine payment terms. Let's look at the payment terms because the minister has also been trying to justify and clarify some of these things. The Sputnik V vaccine supply agreement between Ministry of Health and Sheikh Dalmook. Now, Ghana is obliged to purchase the vaccine as per the total order in accordance with the supply schedule. If Ghana fails to order the committed quantity, the country is obliged to pay 100% of the total unfulfilled committed amount. Now, upon signing the agreement, Ghana was required to pay 50% for each batch supply order per the supply order specification. Ghana agreed to bear all transaction costs in relation to the transfer of funds to the seller in US dollars. Now, all duties, taxes, charges, costs, and expenses shall be borne by Ghana. But interestingly, the Minister for Health has been explaining that no amount of money has been paid to the middleman who has finally or eventually terminated the agreement to purchase Sputnik V vaccines for Ghana. My colleague Joseph Opoku-Gakpo is in Parliament and he joins us from Parliament with more. Gakpo, what else has the minister been saying? Hello, Joseph Opoku-Gakpo. If you can hear me, I'm asking what more you can tell us about what the minister has been telling Parliament today.
Aisha, the minister has also been indicating that even when it comes to the said amount in question, that has to do with the $19 that was negotiated to allow for the purchase of the Sputnik vaccines. The figure was actually a lot higher than that, and that it took a lot of negotiations to actually bring it down to the $19 figure. So Mr. Kwame explained to the committee members that when they went into a negotiation with the vendor in question, he had actually demanded that for each dose of the vaccine, somewhere between $28 and $38 was the appropriate figure for that. He indicated that he did not specifically recall the figure, and it took a lot of negotiations, including at a point in time, a threat by him, Mr. Kwame, that he was going to pull out of the negotiations in order to bring the figure down to a certain extent. And that outcome eventually arrived at the $19. And he was aware that the real figure, the ex-factory price, was actually $10. But the vendor indicated that other things needed to be added, including transportation and needles and all, which was how come the figure had to go up. And he makes the point that he, as the minister, was frustrated at a point in time by what was happening with the difficulty in raising the vaccines. And so at a point in time, he didn't have a choice than to opt for the figure that was actually being demanded by the Sheikh, which is actually the figure to the tune of $19 per dose, despite the claim that the company itself is actually selling it dose for $10.5.
So what's the status of our vaccination exercise as a country? Did the minister talk about when next we're getting vaccines, when next the rest or a batch of the population will be vaccinated?
He said a lot of those processes are ongoing with some of the vaccine makers from different parts of the world. In fact, he alluded to how efforts had been made to directly reach the Russian government. A letter was sent to the Trade Ministry, and a letter was additionally sent to the Foreign Affairs Ministry in Russia with a request for some of the vaccines. Those letters, there's not been any response to them yet, which was they then opted for the route to the middlemen. He says that currently conversations are resumed with the African Vaccine Alliance as well as the COVAX facility. And the indication is that a lot of what they weren't getting previously was because India was actually not delivering any doses to other parts of the world in terms of the Oxford AstraZeneca vaccine, but they are hoping that from the month of August, that supply chain would resume so that then one way or the other, they'll be able to get vaccines through those sources. But he makes the point that government remains committed to ensuring that Ghanaians are vaccinated and that they will not relent on those efforts at all.
But what else has been happening in Parliament today?
The sitting actually just began a few minutes ago, just about 5 minutes ago. To mention this as well, At the level of the committee itself that's probing the situation with the vaccines, the sitting has been adjourned to next week, Monday, to allow for the Minister for Health to return. We gather through our sources that when he showed up today, after he had been summoned about 24 hours earlier, he indicated that he had to go for a cabinet meeting later today, so then he wouldn't be available for a very long time. So the sitting today virtually was for him to provide initial details. One quick observation is that the minority MPs on the committee asked virtually no questions except for one or two clarifications, because then they were actually indicate from what we gather, they're looking forward to the real conversation on Monday, because then there wasn't a lot of time today in order for them to put their questions to the minister, including questions about how come the termination of the agreement actually happened just a day before the committee began its probe. And the letter that the minister read on the floor is actually a letter that's signed by His Highness Sheikh Dalmook Al Maktoum, who is a member of the ruling family of Dubai in the United Arab Emirates, on the vaccine supply that we heard the minister read earlier, that it's based on that the termination has happened. There are a lot of questions about whether government has responded to this particular letter that was written to Mr. Advanmeni yesterday, that we gather the committee would interrogate next week, Monday. On what's happening on the floor, the sitting itself just began. We're expecting that the Attorney General, Godfrey Dame, will be on the floor of the House to respond to a question from the North Tongue MP Samuel Okujeto Ablakwa on the status of investigations into two murder cases. The murder of Ahmed Hussein Twale, the investigative journalist who works with Tiger IPI, and Honorable J.B. Dankwa, who is a former member of Parliament for the Ebuakwa North constituency, and as well two other individuals, Professor Emmanuel Bene and Eko Hayford, who is a former member of Parliament. So we're expecting the Attorney General to come respond to those questions. As well, we're expecting two other things to happen. The loan for $28 million for members of Parliament to actually procure cars. The Finance Committee has recommended its approval. The House is expected to debate the report of the Finance Committee on whether that particular request should be approved. That's also expected to happen a little later today. And finally, Aisha, we're also expecting that a motion that has actually been filed requesting a parliamentary probe into the Frontiers Healthcare Services deal at the Kotoka International Airport to allow for the testing when it comes to COVID-19 vaccines. This being a private member's motion, which was actually filed by Haruna Idrisu, Muntaka Mubarak, Okujeto Ablakwa, Minta Kando, as well as 4 other MPs. We're expecting that the motion will be moved on the floor, requesting for a bipartisan committee to investigate the circumstances under which Frontiers Healthcare Services was awarded the contract at the Kotoka International Airport to actually deliver the testing when it comes to COVID-19. So we're expecting all of that in the next few minutes in Parliament. Aisha.
Joseph Opoku-Gakpo is our correspondent in Parliament. We're monitoring events that will bring you more in our subsequent bulletins. But let's get onto the Ghana Health Service website and check updates of our COVID situation. As at now, new cases stand at 158, active cases 2,512. Confirmed cases now stand at 98,114 and recoveries 94,796. Death toll has risen to 806.